Kenya has managed to reduce its child mortality rate by more than a third in the last decade. That's according to Save the Children's new report, Lives on the Line. And while that's good news for this playful bunch, the organization warns too many children in the country are dying of malnutrition. It says more than 30% of Kenyan children suffer from stunted growth because of an inadequate diet, and that girls are 16% more likely to die before the age of 5. Save the Children says it's in the poorest areas where intervention is most needed.
Here in Kenya, we're seeing still 189,000 children under the age of 5 dying every year. We feel it's still an unacceptable figure. We're really heartened by the fact that the government of Kenya has been seen to prioritise this in recent months with the provision of free maternity care.
But even with this boost, Save the Children warns that Kenya is far from reaching the 4th Millennium Development Goal, that of reducing preventable child deaths by 2/3 by 2015. Kenya ranks 28 out of the 75 countries surveyed by Save the Children.
As the numbers of children under the age of 5 their numbers of deaths have reduced, we've actually seen an increase in the proportion of newborn deaths. And by newborn deaths, we mean children in the first month of life. So in many ways, those are the most challenging deaths.
The Kenyan Health Ministry admits it has a long way to go and it's frustrated by the slow progress of reform. But they've identified key areas that need to be addressed.
If you look at some of the surveys we have done in this country, we have found out that majority of our mothers are delivering at home. You find that skill attendancy is not there. So we end up by having children that come out, but we lose them. And so they are counted as children who are born alive and they died. That's why that figure of 37 is raising up, because we need to do something about it.
One country that has done something about reducing child mortality rates is Niger. It's one of the smallest and poorest African countries. The report says it has cut the number of under 5s dying by nearly 2/3, and it's on track to achieve the UN's global goal on child mortality. Valdi Carlson, SABC News, Nairobi, Kenya.